As we continue our conversation on human capital investment, now I'd like to discuss the various inputs to human capital, or the inputs that enhance the productivity value of the human being in the capital and production process. We think of these generally as being separated between worker investments and firm-level investments. We're going to focus more on the worker-level investments than on the firm as we continue on with this module. But think about it. Human beings are simply labor units with some endowments that they receive either because of the household in which they were born, or they received it because of the DNA strands with which they were born, or the experiences that they had as they were growing up. So we'll think about these as being relatively homogeneous or similar labor units, albeit modestly differentiated because some people are of better physique, some people are of better natural health, etc. Some people are more intelligent naturally because of their the endowments they received from their family upbringing, etc. But we think about these as being relatively homogeneous or similar labor units. But when these labor units seek enhancements to their productivity, either through education, healthcare, or immigration and mobility, so education, healthcare, and immigration, they may become more productive, and based upon the valuation method that we're going to use, they would be more valuable. And again, we'll use principally the income production or income and product productivity method of valuing human capital. So worker investments might be investments in education, might be investments in healthcare, might be investments in immigration. And then we'll have some firm-level investments. So let's think first about investments of healthcare. How is it that healthcare becomes an investment in human capital? Well, think about it. We have a positive correlation between health and productivity. When a worker's health increases, we believe their productivity increases. Maybe their productivity increases because as they're healthier, they can work more hours in a day, or they can work the same hours in a day but at a greater intensity for those hours than if they are not healthy. We can think about it in terms of they can work to an older age. If I'm infirm and I'm in my 50s, then I'm absolutely looking forward to an early retirement at age 62. But if I'm healthy and I'm in my 50s, then I maybe am going to wait until I'm age 67, 70, 75 perhaps even. If I get, as I continue to be in good health. It's ironic that I cough as I'm now talking about being in good health. But if I'm healthy and I'm in my 50s, I might be looking forward to some 10 or 15 years of productive work life, which clearly enhances my value in the production process. Similarly, as these inputs to human capital are positively correlated, that means if one's health declines, then one's productivity similarly declines. So healthcare is an absolute contributor or input to human capital. We can even think of healthcare a little bit further in this regard. We can think that some people are infirm enough or unproductive enough that they actually require others to care for them. So that lack of investment in their own health, and maybe it wasn't a conscious choice of investment, it may have been an accident, it may have been a disease that they picked out, had nothing to do with health choices, but it renders them to have a level of health, they require then some type of health care, may cause us to have this very overtly negative relationship. Well, education is not that much different. We know that education yields some higher level of income. We've talked about this some. Excuse me, not production, but productivity. And we know that productivity changes are correlated with income changes. So when productivity rises, income, we believe, rises because of marginal revenue product of labor. When productivity falls, we believe incomes, wages, fall. Again, marginal revenue product of labor. So think about it. All of us have been involved at some level You as you're going through this course, me as I've done my higher education all the way through my doctorate degree. We've been involved in some higher education, not simply because we like going to school, although we might, not simply because we get some utility out of doing homework and listening to modules such as this, but because we're in search of a higher income at some point in our lives. So you clearly are, I would think most of you. And so we believe that increases in education lead to increases in productivity, which lead to increases in income. And the income and production model of valuing human capital is what we're focused on here. Well, that also would suggest that when one has lesser income than the average or norm, they probably have a lower productivity level and have a lower income level. And we know those things. We'll talk in another module later in this course about the relationship between pay and productivity. And there we'll actually look at some statistics that talk about productivity of individuals and the compensation the individuals receive. But at this point, just think about this as a general concept. Well, I think it's fairly intuitive why health and education levels might lead to changes in productivity and why they may be positively correlated. It might be less intuitive to think about how it is that immigration is an input to human capital. I mean, a labor unit in Botswana and a labor unit in the United States are the same labor unit. So how is it that immigration is an input to human capital? Well, if we think about it, if one immigrates, there is a cost to immigrating. If one goes from, say Mozambique to California, they immigrate, there are numerous costs that must be borne. There are visas to be obtained. There's travel to deal with. There are resettlement costs in the new location. Those are easy costs to think about, but there are some other costs that are harder to value. There's the loss of social networks. They've left their family, friends, etc. behind in Mozambique. There's the loss of familiarity of surroundings. There's the loss of those surroundings. You know, if I'm a Utahn and I love the mountains and I go to Kansas where it's pretty flat, then I might lose some utility because I don't get to see these beautiful mountains any longer. I don't have the Wasatch Front or the Uintas to hike in any further. There might be familial loss. We think about these as social and surrounding losses. There might be thought of in a more general heading of psychic losses. So immigration comes at an absolute cost. Well, why does one immigrate? One either immigrates because they have been forced from an area, or because they seek some benefits that new area provides. And someone going from Mozambique that has skill level A, let's say that's moderate level of skills, probably doesn't have a lot of opportunities in Mozambique to get good paying employment even though they have a moderate skill level. But if they have immigrated to California, they've borne all of these costs, then they're expecting some financial gain at the other end, right? They're expecting to see some income increase that's relatively substantial in order to make up for the cost. Otherwise, if they don't see an income increase that's relatively substantial that makes up for the cost, then they're saying that the satisfiers, the utility benefit that they get from this act of immigration is also important to them. And we know that money is important to REM, rationally evaluating, manipulative, maximizing economic agents, but money is important, but so are other utility satisfiers. So immigration, just like education and healthcare, is absolutely an investment in human capital. And we can value it. If we have a cost, and we know that when one goes to that new polity or they go to a new location, they receive hopefully some additional monetary value, if not some additional utility value. It doesn't have to be immigration from one nation to another. Many of us have gone from one state to another in search of job opportunities. When I was younger, I had a position with a well-respected Wall Street firm, and I was given an opportunity to go from California to New York. And my opportunity in New York was a difficult opportunity, but it was an opportunity that was very handsome financially. Yes, I had to face crowded commutes, and I had to be in a city that was not nearly as beautiful as the San Francisco area that I'd grown up in, or at least it wasn't beautiful to me. I didn't take my siblings, I didn't take my parents, I didn't take the coastal region that I grew up in California. I did go with my spouse and my children, so some of my family was with me, but virtually all of my other friends remained in California, and I went to New York in search of a greater opportunity. Well, that wasn't going from one nation to another, although admittedly New York City, it may as well be a different universe than California in many respects. But it wasn't going from one country to another, it was just going from state to state or city to city. But I expected to have the expense of that mobility or immigration or relocation be compensated by some additional income opportunity. There was a compensating wage differential, if you think about it in this respect, that I could observe because I was able to immigrate or relocate, become mobile, and go into a different environment with a different opportunity, such that my productivity value was greater in New York than it was in the San Francisco area. Enough greater to cause me to be willing to make that move and to suffer that loss of social network, etc. So those are the three inputs to human capital: education, healthcare, and immigration. And those are the worker investments. When we think about firm-level investments, we need to think along similar terms. Firms invest in the human capital of their workers. They will do so if they believe that the investment will yield benefits to the firm, short or long term. And those investments might be training, might be some overt schooling or education, might be some health insurance benefits, sick leave, vacation pay, safety issues being remediated, etc. All of these things which they believe will add greater productivity to their worker. It's interesting, the firm will pay for these kinds of enhancements if the firm believes that the productivity difference is such that the firm will benefit from it without having to pay that much more to the worker. So we can think about these in being firm benefits, or firm investments rather, but we have to think about whether the benefit that is derived is express or specific to the firm, or if it's able to be used by the employee regardless of the firm that they go to. If it's expressed to the firm, if it's specific to the firm, then the firm is likely to pay for those investments themselves. They'll pay the entire cost of them. However, if it's an investment that the firm is going to make in the employee that makes the employee more productive, and the employee can use that productivity enhancement at any firm, then perhaps the firm is going to accept or expect that the employee either sign a contract that prohibits the employee from using it at a competitor firm, or sign a contract for a certain number of years of employment, or perhaps the firm would require that the employee participate in the cost of that investment. So this is something of the inputs to human capital and how we think of them as differentiating the human being in the capital and production process, causing different value to be associated with the human being in an income production value structure, and helps us answer the question, why did some workers receive different wages?